And we begin with breaking news. An urgent call from more than 1,500 physicians from across the state for the governor to order Tennesseans to shelter in place in response to the COVID-19 outbreak. A letter delivered to the governor sounds the alarm about what it calls an escalating and destructive situation. News Channel 5 Chief Investigative Reporter Phil Williams talked to the experts.
This letter, obtained by News Channel 5 Investigates, was signed by more than 1,000 physicians from across the state. In it, they warned the governor time is running out.
We are at a crossroads. We are standing on the edge of the abyss. We're looking over the abyss, and what we do today will decide whether we're able to step back or to jump over.
Dr. Aaron Millstone of Franklin is among the who's who of Tennessee physicians, saying the COVID-19 crisis demands a statewide order to shelter in place. A letter sent to the governor warns it is our estimation that we have little time to flatten the curve on the current situation. China and South Korea have made great strides by prohibiting travel and closure of non-essential industry and business. We must act with the same level of boldness.
The state of Tennessee has a narrow window. That window will likely close within the next 7 to 10 days. And then the spread of the virus will be so rampant that no matter what we do, will not prevent patients with the virus here in Tennessee dying or being critically ill from this illness.
Among those signing the letter are leaders of the Tennessee American College of Emergency Physicians, the Tennessee American Academy of Pediatrics, the American College of Physicians, and the Tennessee Medical Association.
We're never going to be able to mandate people's behavior in their homes and in their yards and in their neighborhoods.
It comes just a day after Governor Lee suggested mandatory lockdowns were not his style.
But I believe to the degree that we can curb behavior and change behavior and find responsible behavior taking place across our state, to the degree that we can do that without mandates, it's better for everyone. So that's going to be our approach.
That we want to be stacking as many cards in our favor as we possibly can to protect lives.
Dr. David Aronoff from Nashville is one of the top infectious disease experts in the country.
I think we need to be able to look back and say we did everything we could in our power to prevent it from being worse. And I think that's where we're at with asking for shelter in place mandate.
And sheltering in place means going only to the grocery store for essentials, going to the pharmacy for essentials, not going out to eat, not going to bars, not working out in gyms, and staying home whenever possible.
Dr. Millstone says our hospitals are not equipped for what might happen if a shelter-in-place order is not given.
If we do not shelter in place, the disease will continue to spread, and then we will become more of a center for the disease. So what you're seeing on the coasts of the United States, California, Washington, New York, even to the south of us, say Louisiana, New Orleans, those could become our new reality if we do not go forward with the shelter in place.
The letter suggests that the order to shelter in place should last for 14 days to try to get a handle on this crisis. Phil Williams, News Channel 5 Investigates.
The Middle Tennessee Mayor's Caucus also agreed to support the physicians, saying in a letter to the governor, we feel strongly that the quickest path to recovery is a uniform response to this challenge. They add, we urge you to consider the recommendation of the medical community to implement this directive.